The 8 a.m. scramble for GP appointments could soon be a thing of the past, according to the Health Secretary, Wes Streeting, as nearly all surgeries roll out online consultations for their patients.
Well, the British Medical Association says the move to digital appointments actually puts patients at risk. And with the BMA announcing a fresh round of strikes heading into the busy winter period, are patients going to get the right care? Health Secretary Wes Streeting joins us now. Very good morning to you.
Good morning.
I know you want to tell everybody that this is a good thing. However, you've got significant resistance from the British Medical Association GP Committee Chair, Katie Bramall, who is extremely worried. Let's just listen to what she says.
It's resulting in us having to take GPs away from patient-facing appointments to triage the hundreds of online queries. I would much rather we get investment from the Health Secretary to bring more GPs, more nurses.
I wonder if you could reassure the chair of the GP committee and our viewers that resources come with this development.
Well, the irony is that Katie Bramall signed up to the GP contract that committed general practice to online access. We've put £1.1 billion into general practice, and we've also recruited, whereas we promised 1,000 more GPs, we've actually delivered 2,500 more. And I think the disappointing thing about where the BMA is on this is that she's doing a real disservice to GPs across the country who have embraced online access. I don't feel we've had to fight GPs or do this to GPs. They have embraced this because they know that it improves patient access, patient satisfaction and patient care. And as for this complaint that we have to spend time triaging patients who are getting in touch, well, I accept the BMA's view is that the NHS would run wonderfully if there weren't any patients, but the NHS is there to serve patients. And what we've seen in the past is a huge amount of unmet need, unmanaged and unseen risk, because people can't get through at all to a GP, can't see anyone, or maybe even end up in A&E, which is not only a worse experience for patients, but also more expensive for the taxpayer, because A&E should be accident and emergency, not anything and everything.
Absolutely right. I wonder whether we can ask you some of the viewers' questions on this. Donna's emailed in, my surgery is not allowing online booking of appointments. Could you ask the Health Secretary if it's going to be mandatory, and if so, when?
It is, and it is already. So unless there's a really good reason, like legacy IT systems or something that is practically standing in the way, all GP services should now be available online as well as through conventional means.
And what about the elderly? Enormous number of people pointing out that they often don't have access to the means to go online. Are the elderly still to call at 8 a.m. and face that scramble? Or is your hope that there isn't a scramble if most people are online?
Yeah, the great thing is if people like me are booking online and accessing online, that frees up telephone lines for people who either can't or don't want to use online tools. And we definitely need to make sure that NHS services are accessible to everyone, whether that's older people or indeed people with a range of disabilities who need to access the NHS in different and accessible ways.
The good news, Wes Streeting, and I think unusually for the NHS in the last few years, we've also had lots of positive comments this morning. Mark, via email, yesterday I tried the online booking facility for the first time and it worked like a dream. No stressful experience in the telephone queue for 40 minutes. There is a risk, though, for you in this, isn't there, with the way the NHS works? Because there is clearly huge pressure in the NHS, in waiting times, in A&E, and GP surgeries. But if you make it easy for people to go online, to book, to get appointments, the experience of the National Health Service is that leads to more demand, more requests, more pressure, more people thinking, well, if it's easy, I'll go. Does that make your task of getting waiting times down harder?
Maybe, but I think we've got to have an NHS that's there for people when they need it. And the truth is that what we've ended up with is a late diagnosis NHS which is both worse for the patient and more expensive for the taxpayer, because the later you're diagnosed, the more expensive and complicated the treatment, and also the harder it is to achieve a successful outcome, especially on something like cancer. So we've got to make sure the NHS is there for people where they need it, when they need it. We do need to reduce demand on the NHS, and that's why this government has put such a heavy emphasis on public health and prevention. We've done such a huge number of things since we came into office, from legislating to create the first ever smoke-free generation and to clamp down on kids vaping, or the action we're taking on diets and nutrition for children and young people. There are lots of things we're doing on the public health side of the things to create not just a healthier NHS, but a healthier nation.
Can I ask, what do you make then of the fact, because you obviously criticised Katie Bramall, who's from the GP committee at the BMA, for what she said because she signed up to the contract. However, she, in a speech to local medical committees, said she felt betrayed and lied to because a recent survey found that more than 40% of more than 1,300 practices had to reduce the number of face-to-face appointments because GPs are so busy dealing with online communications. That's not a win. And GPs are now threatening to join NHS strike action over this new system. Is it the case that whatever she signed up to originally actually is not working out for them in practice? And you do need to just take a moment and work out how this is going to work, because GPs want this to work.
Yeah, and patient satisfaction has gone from 60% when we came into office to 75% in terms of patient access. Now, I would be the first to say that still means 1 in 4 people are not satisfied, so that's not good enough for me, and we've got to go further. But that is a real improvement in just over the space of a year, and GPs deserve real credit for that. I would have thought GP reps in the BMA would be shouting from the rooftops so that they can speak about their profession with pride, rather than sounding like moaning minis in the corner while their members are getting on with the job and doing a really good job at that. I would also say I'd be the first to acknowledge that GPs are still under real pressure, and that's why we've recruited 2,500 more GPs to the front line. We're investing more.
Can I just take you back to the budget and the politics around the budget? Rather a chaotic few weeks, some unusual, unexpected U-turns, the government saying they were going to have to break the manifesto and then changing their minds. Lots of people finding it hard to understand what was going on, but there was a botched Downing Street briefing criticising you, which backfired upon them. You handled that very well, including on this programme. You made it clear, as did others, that manifesto commitments are there to be kept. And then the government from number 10 in the Treasury did a U-turn. I wonder whether that's the Wes Streeting effect in action.
I don't know about that, but I do think that keeping promises is important, and we're trying to rebuild our economy, rebuild our public services, but also to rebuild trust in politics, which is at rock bottom. I mean, we are well below estate agents and tax inspectors now in terms of our levels of popularity. And it's not hard to see why, given what this country has gone through over a number of years. And that's why we mustn't make the promises that we made light promises or casual promises. We do have to keep to them. But there are big pressures. I actually think the Chancellor's got the hardest job in the government, and she's wrestling with a large number of pressures. The important thing is that we see year-on-year improvement, not just in the public finances, but in the finances of every family and business in the country, because that's where we're going to get growth from. It's from business, it's from enterprise, it's from innovation. Government has to help encourage that, but ultimately it will be business that gets Britain back to growth.
It was a massive tax-raising budget. In a word, did she keep her promise in the manifesto not to raise tax on working people, yes or no?
Yes, income tax, national insurance and VAT. In that spirit of honesty, Rachel did say very clearly in her budget statement that freezing the thresholds for the rate at which you pay the 20% and 40% tax rates, that does mean that some working people are paying more than they would have done had she not frozen the thresholds, and she was upfront about that. And I thought it was important that she was upfront about that in that spirit of transparency.
Interesting, you couldn't answer that in just a yes or no. Wes Streeting, thank you very much indeed.